ECOG 1505 is a very large adjuvant trial looking at the role of bevacizumab. And so the trial actually completed accrual in the fall of 2013. It actually opened to accrual a number of years back, so it's been a long time, but it was a 1,500 patient trial, so quite a large adjuvant study. And all patients on the trial received adjuvant chemotherapy. The randomization was to get bevacizumab or not, and the bevacizumab patients received that with the chemotherapy on an every 3-week schedule, and then continued it up to a full year. So we still have patients on treatment. We are expecting results to read out sometime in the next 2 to 3 years. The overall survival endpoint makes it a little harder to guess, of course, when we're actually going to reach that endpoint, but we've done some modeling. So that's our best guess, is sometime in 2016. And we'll just have to wait and see. Obviously, we're hoping that that's going to lead to improved survival for patients who've had resected non-small cell lung cancer. So ECOG 1505 is an adjuvant trial. It takes patients with stage 1B lung cancer that was at least 4 centimeters in size, and this is by the AJCC 6th criteria, so the older version which was in place when the study opened. So if there's no lymph node involvement, the tumors had to be 4 centimeters in size or larger. If there was any nodal involvement, the tumor size didn't matter. We were expecting the trial to mostly be stage 2 patients and stage 1Bs. There are also 3A patients allowed, so patients who have mediastinal nodal involvement. We were initially expecting that to include just a small number of patients, those who had microscopic disease, because we don't allow for adjuvant radiation therapy as part of the trial. We had concerns about the radiation and bevacizumab interaction. When we did an interim analysis, which I presented a few years back at the World Lung Conference, we were surprised to see that about a third of the patients are actually stage 3A. Of the patients enrolled up to that point, it was about half of accrual when we were looking at that. So it was about a third. So we'll see how that plays out in the end. Patients are allowed to get one of 4 different chemotherapy regimens. So cisplatin vinorelbine, of course, is what's been used in the majority of the adjuvant trials to date. We also allowed for cisplatin docetaxel, cisplatin gemcitabine, and then after the trial had been open for a couple of years, when the cisplatin pemetrexed regimen became a first-line approved regimen, we added that as well. So there were 4 different chemotherapy options. The patient and physician needed to select the chemotherapy choice first, and then randomization occurred. We wanted to make sure there was not an imbalance in the chemotherapy arms. At that point, then patients are randomized, and half received the chemo plus the bevacizumab, half received just the chemotherapy. 4 cycles of chemotherapy, as is a standard adjuvant regimen. Patients, the inclusion and exclusion criteria were what one would expect for patients who were going to be receiving 4 cycles of adjuvant cisplatin-based chemotherapy, so needed to have adequate renal function, that sort of thing. And also for the bevacizumab, the usual exclusions there as far as increased bleeding risk. We wanted to make sure patient had controlled hypertension. We did not exclude patients who were on a standard dose of an anticoagulation regimen. And as mentioned, accrual stayed relatively stable, about 20 to 25 patients a month from the time it opened until it finally closed this fall. It was just really, it was clockwork as far as the enrollment. It was pretty striking in that way.